With the title, Growing Body Parts, which I hasten to add was not my title, but Ian's title, I thought that perhaps you might be expecting at least a recipe of how to do this. Take a pinch of stem cells, put them in the right condition, culture them at 37 degrees, and voila, you have the most beautiful features, just as Mother Nature had created. I'm sure that you're all well aware of the recent hype, both in the press and in the newspapers. Every day we see breakthroughs in how we can grow different tissue parts, from the brain, right ears, and also growing a nose on your forehead. But more recently, even more complex body parts can be grown in the lab. So are we entering an era where at the click of a button, we can order any particular organ that we want? Simplistic, yes. We've just heard of the wonderful work of Andrew Darwood, of the technological advances that we've made and how we can create these amazing implants for these patients, custom-made, personalized to suit their very personal defects. However, I would like to take you through a short journey, and my journey is going to be a journey of nature, a journey of ourselves, the most sophisticated tool that we have, our body, and how our own body can regenerate body parts. We've heard the most wonderful work that Andrew Darwood has explained about the technology whereby we can create specific implants for patients, customized for their specific needs. But as a biologist, as a cell biologist, I believe that growing body parts also encompasses the body's own inherent healing mechanisms. And I'm going to take you through a short journey to show you how your body can repair itself. We've heard a lot about facial deformities, and we've seen some pretty ghastly images of deformities. And this is a typical example of a patient pre-operative and post-operative. There is no doubt, and we've heard testimonies of these people, one just before my own talk, how such drastic traumas and disease can significantly alter a person's life. So the current treatment modalities, as we've heard, it's usually surgical reconstruction. Andrew has explained how different parts of the anatomy are taken, and Ian, with his clever reconstructive know-how, is able to reconstruct the organ using the body's own tissues. But this is extremely difficult. We've heard about the number of interventions that patients have to have. We've heard of how long this can take. And in some complex cases, however hard these amazing surgeons try, they can't always achieve the quality of life that they would like. So in all of these cases, whether minor or major, the priority is obviously the functional and psychological well-being of the patient. It's always the patient that we have at heart. And despite the advancements and all these amazing techniques that we've heard, it still remains a challenge, and hence the importance of a centre such as NFORC. So how can we regenerate body parts? How do we do this? The work I'm going to describe to you is just a snapshot of some of the work that's ongoing at King's College London in our division of tissue engineering and biophotonics. We are aiming to regenerate tissues, to grow replacement tissues from stem cells in the laboratory. And this is done by removing stem cells, and stem cells reside in many tissues and organs in your body. But we remove bone marrow. You can remove the bone marrow from the patient's hip, and the bone marrow contains stem cells. These stem cells can be isolated in the laboratory, and they can be expanded and grown in specific laboratories. These cells are then placed onto a scaffold or an architecture. We can't just inject the cells into the body. We need to have a way of directing them at the site and retaining them there in order to regenerate the tissue. And then these scaffolds are placed back into the body. In order to do that, we must provide nature with exactly the same template as the natural tissue. And in our group, we have people who are working on developing materials that simulate these biomimetic materials, materials that mimic nature. And in this particular example I'm going to show you, this is a bone graft whereby both the physical, chemical, and mineral content is exactly the same as bone. In this cartoon depicts many years of work, and it basically shows how we can take stem cells and an in vitro approach actually develop a vascularized graft that can go back into the body. So having isolated these cells, they can be conditioned in special culture medium to be differentiated to become basically any cell that we choose it. And in this instance, it's bone cells. We then incubate these stem cells in the presence of blood vessel forming cells, and we place them on the scaffold that I've just shown you. We culture this at 37 degrees under the same conditions as your body, with the same kind of gaseous exchange and nutrients, the sort of things that your body requires in order to regenerate and recover. After a certain period, we have these development of these microvascular type structures. And if I show you in this image here, this is a confocal microscope image, which I'm going to be very disappointed if it doesn't work. And sadly, I don't think it will. I'm very disappointed. I was up half the night trying to get these to work. But anyway, what it basically showed was the formation of these vascular network inside the scaffold. And this image here was going to show you how this vascularized graft, once it was implanted back in vivo, completely integrated with the host tissue. So can we go from the bench to the patient? Can we actually grow body parts? I don't believe we can grow entire body systems as such, but I do believe that we can actually grow specific tissues. And these specific tissues are then placed back into the body to be able to integrate fully with the body system as a whole. So I've shown you, here is this material that we have developed in our laboratory. I've then demonstrated to you how we can put cells on these materials, different types of cells, because the body exists in unison with many cell types. We have very many different tissues that live in harmony. So here we have tissues that form these tubular-like structures. And if you look at, this is what you would have seen in the image had it worked. This is a beautiful sort of vasculature. I call it a vasculature, but until you can actually show that there's blood flow going through it, I'm going to call it a primitive capillary-like structure. And then to be able to transplant this back into the patient in a prevascularized state that would basically immediately anastomose, immediately integrate with the existing host tissue, because it is pointless implanting any kind of graft in the body that will not take. We heard this morning about various pieces of tissue that's been sewn back onto patients' noses and things that got infected and turned black. Essentially, that's tissue death. And what we have to achieve a graft that will integrate with the body in such a way that it's supplied with a blood supply. And only if it has a blood supply will it be able to integrate and will it be able to completely replace the defect. Again, I'm not averse to advancement in technology, certainly not. There's a lot of work going on in our group using 3D printing. And 3D printing is an amazing new emerging technology. Well, it's not that new, but the applications and what we're doing with it now are. We can create these amazing printed scaffolds with different unique geometries because porosity is very important. If you're going to put a material or a graft in the body, it's absolutely imperative that cells can get into the scaffold, into the graft, and they can survive in the middle of the graft. Because if they can't, and all you have is literally some kind of integration just at the edge, you're actually going to get cell death inside that scaffold. And of course, we now have the capability of not only being able to print all these different geometries, but we can actually make them biologically responsive. We can actually make them instruct cells in the body. This is what you have to do, and this is how you do it. I don't suppose this is going to work either, but disappointingly, no, it worked this morning. Essentially, this is a 3D printer, and this is again work that's going on within our group. And this process allows us to create very specific geometries, very specific architecture of individual scaffolds for patients. Patients come in, they have a CT scan of their defect site. The CT scan is able to take very precise measurements of the defect. And then we can go back and this information can be fed back into the 3D printer. And this 3D printer is able to make the exact same defect that was scanned in the patient. So we are really getting close now to personalized medicine. It's made individually for that patient. So are we there? Can we actually grow body parts? Well, I just want to summarize what we as a group have achieved. Yes, we can. We can make a viable engineered bone graft, not a body part, but a bone graft that will be then transplanted into the body and integrate with the body. We've shown, and I've demonstrated, sadly not by my video, which didn't work, the formation of this primitive capillary-like structure inside the scaffold, but outside the body. So this is in a dish, in a culture dish in the lab. I've shown that if you can take stem cells from the patient, and if you can combine this with blood vessel-forming cells, the two can coexist, and you can simultaneously get this formation of this vessel-like structure and mineralization of the scaffold. And what I forgot to tell you is that the scaffold resorbs. So over a given period of time, the scaffold will be completely removed from the body and completely replaced by new tissue. I've demonstrated again, and sorry, I apologize for the video, that when implanted, these grafts demonstrated successful integration with the host tissue. It was very difficult for you to have seen on the image where the graft began and where the actual host tissue was. Such good integration. We've demonstrated then that this efficient manipulation of the in vivo local environment, so in other words, we're stepping out and we're looking at the body and we're looking at how the body heals itself. We're trying to recreate this outside in the laboratory to then be able to make a transplant that is as good as the original tissue. So what of the future? I'm a cell biologist, and I believe that the future is in situ tissue engineering. So what does that mean? That means that we need to give the body a kickstart. The body knows how to repair itself. It just needs a little bit of help. Where we have large defects, where we know that the tissue will never regenerate because of the enormity of the damage or the trauma, we need to give it a helping hand. By creating the kind of scaffolds that I've just demonstrated to you, made just as Mother Nature made them, giving them the right instructive cues, we can actually ask the body to heal itself using its own inherent healing mechanisms. I've only shown you a snapshot of a lot of work that's going on within the group, and a lot of the people listed on this acknowledgement, and I apologise if anybody's missing, are here in the audience. And it's the work of this group together in a multidisciplinary way that is leading to the kind of results that I've shown you. And I believe that the future is in the making. It's in the hands of NFORC, and I believe that working together, as Ian has demonstrated time and time again, with the testaments of the patients and the surgeons and people from various walks of life, that we can achieve the best outcome for all of our patients. Thank you very much.